Mr. Speaker, on Friday, over 100 people rallied in Craik in order to save their rural health care services in their community. And, Mr. Speaker, they're incredibly frustrated by what this government is doing. They have invited the Premier to visit their community, to tour the health centre, and to see firsthand how incredibly valuable it is to their community and the entire region. Now, Mr. Speaker, the Premier has said he's too busy on his many trips up and down Highway 11. He can't peel in for 30 minutes to pay a visit and to see it, Mr. Speaker. So today, over 70 residents have come to the legislature to voice their concerns. With record revenues, Mr. Speaker, record revenues, how can he justify the cuts to rural health care services that have happened under his watch?
Well, Mr. Speaker, this year's Oscar for wildly misplaced priorities has to go to this Sask Party government, along with the Oscar for extreme hypocrisy and dealing a death blow to an entire film industry and then heading off to Hollywood to whoop it up at this year's Academy Awards. This is the government that shamefully decimated our province's film industry, taking a major step backward in economic diversification and a vibrant arts and culture scene. And yet, it's the same government that sent its Crown Corporation CEO to Los Angeles to attend an Oscars party. One of the reasons why the CEO of Creative Sask flew to Los Angeles was to plan a big Saskatchewan-sponsored Canada Day party in Hollywood. Schools in our province are being held up by temporary posts. Our hospitals and senior care facilities are seriously understaffed. People from rural Saskatchewan have to come to the legislature to demand basic health care services in their communities, yet this government is choosing to spend money on a party in Hollywood. To the minister, how can he justify such misplaced priorities?
If they were serious about ending the John Black version of lean, they would cancel the 140 trips that are going ahead very soon to the States. But they're not, Mr. Speaker. It's all about the optics here. They'll say they're ending early and then just send everyone on down to Seattle and Utah to tour the airbag factory. It makes absolutely no sense, especially when you have these needs here in the province.
Speaker, it's outrageous that this government doesn't even know how much it's spending on the John Black Lean Pet project. It can't even tell us how much has been spent on lean-related travel for just 8 officials. Just 8, Mr. Speaker. The government says it would take 177 hours to calculate that. And here's the contrast. John Black has this government using stopwatches to track everything nurses do, right down to the second. Quote, nurse walks, 10 seconds. Nurse checks, grabs, 4 seconds. Nurse walks, 17 seconds. Nurse turns around, 1 second. Wow. This government is actually following nurses around and timing everything they do down to the second. Yet this government isn't even keeping track of its own lean-related expenses. To the minister, when will this government put down the stopwatches, pick up the calculators, and finally tell Saskatchewan people the truth about the full cost of its lean pet project?
Speaker, in light of 5 schools being deemed structurally unsound from a special investigation, schools that weren't safe for kids, for the Minister of Education to brush off his responsibility is absolutely disgusting, Mr. Speaker. The school divisions of this province care about this deeply. They've been hamstrung by that government on this front who haven't supported them, and you would think that 5 schools that were found to be unsafe in one small review would be a wake-up call to that minister to work with school boards to make sure that every school in this province is safe for the kids that are entering into them.
With answers like that, it's no wonder that more and more Saskatchewan people are starting to question the choices that this government is making because of its wildly misplaced priorities and wasteful pet projects.
Over the course of about a month, Catherine was transferred 6 times between 3 hospitals. For those 6 transfers, Dave was billed $5,045.74. He arranged to pay $30 per month. It would have taken him 14 years to pay off that ambulance bill, but that's all that he was able to afford. But then they started charging him interest of $60 per month, so Dave couldn't even keep up. It's not just seniors, Mr. Speaker, affected by this. Leandra Busas Gunn was just 7 years old when she died. She was born with a congenital condition, had a compromised immune system, and she had endured awful seizures. When Leandra died, when the little girl died, Sarah still owed over $7,000 in ambulance service. And get this, she says the interest that they kept adding onto the bill was worse than that on a credit card. Despite record windfall revenues, this government has not improved ambulance fees one bit. In fact, Mr. Speaker, it was this government that jacked up ambulance fees, despite record provincial revenues.
Saskatchewan has the second highest injury rate in the entire country, and this government should be taking it seriously. Yes. To the minister, will he restore random inspections and reinstate proper enforcement for occupational health and safety?
This government killed the film industry in our province and drove hundreds of families out. Yet this government apparently has no end of money to host parties in Hollywood and at film events in Toronto. Where is the sense in that?
Tony's condition has deteriorated so badly that he's at significant risk of losing some bodily functions. That's why his neurosurgeon has deemed this an emergency situation. But the hospital says it can wait until Tony's organs are compromised. How is it that emergency surgery takes 2 weeks to be done?
This government's approach to our healthcare system is so frustrating. So many misplaced priorities, so little focus on what really matters. Earlier this week, we learned that John Black has this government tracking everything nurses do, right down to the second. But it gets worse, because this government's $40 million American consultant also has this government tracking surgical patients right down to the second. According to a John Black standard work process, patients getting ready for orthopedic surgery are given 30 seconds to change and go to the bathroom. Mr. Speaker, instead of standing outside of patient bathrooms with stopwatches and instead of writing up standard work process documents that allot how much time each patient has to go to the bathroom, instead of wasting time and money on that, this government should be focused on situations like Tony's, in which his neurosurgeon says he desperately needs emergency surgery, but he can't get it because there's no bed available. To the minister, when can we expect the wasteful and silly pet projects to end, and when can we expect this government to finally get serious about fixing the basics in our hospitals, like making sure people like Tony get the emergency surgery he needs?
We've obtained inspection records. It's a laughing matter to the folks over there. We've obtained inspection records for the Vanscoy mine, and they clearly show a disturbing pattern. Not one unannounced inspection since April of 2012. To the minister, what's the specific plan to reverse the changes this government has made to occupational health and safety in Saskatchewan?
Mr. Speaker, we have at least $1.5 billion in urgent infrastructure needs in our schools here in the province. Right. We have school roofs that are being propped up with temporary posts. We have little kids, Mr. Speaker, who are being told to bundle up with extra layers because the windows have to be propped open in the middle of winter because of the air quality in their classrooms, Mr. Speaker. But this Premier, this government will not release any information. They say it's a big secret. Right.
Mr. Speaker, officials within the Ministry of Environment have told me they're no longer allowed to do vital inspections because the Sask Party government doesn't consider it to be essential travel. How can the Environment Minister justify that?
But you know, Mr. Speaker, instead of using the massive revenues it has collected over the last years to fix our ambulance system, this government, you know what they chose to do? They ramped up fees, Mr. Speaker, having Saskatchewan patients pay even more. My question to the Premier, is he willing to admit that that was a mistake? Hear, hear. A simple question to the Premier with a yes or no answer that is all that is needed. Will the Premier scrap the inter-facility transfer fees for Saskatchewan patients? Yes or no? Hear, hear.
Margaret Warholm, Art Healy, Savannah Gunderson, Emma Kruszalnicki, Jessie Selwood, Lauren Rowell, Margaret Fraze, Adrian Seaborn, Fern Shingoose. Theirs are just some of the heartbreaking stories we've heard from families that have come forward and spoken out publicly. And the Ombudsman has heard from many others from all over the province. To the minister, how many more families need to come forward before this government takes its head out of the sand and finally do something meaningful about seniors' care?
Gail and Jim Sack are here today along with members of their family. Gail and Jim were victims of carbon monoxide poisoning in their home in North Battleford, and they received life-saving treatment in the hyperbaric chamber in Moose Jaw. The Moose Jaw Hospital has the only hyperbaric chamber between Toronto and Edmonton. This public hyperbaric chamber has been used to help victims of burns, carbon monoxide poisoning, and people with wounds who are taking a long time to heal. But there won't be a public hyperbaric chamber in the new Moose Jaw Hospital, and it doesn't sit right with Gail and Jim Sack.
Yesterday, I attended a community meeting with about 100 people from my constituency. They're frustrated with this government's decision to shut down the Yarrow Youth Facility on the edge of Saskatoon and to relocate the open custody unit to the Kilburn Secure Youth Facility in the Buena Vista neighbourhood. In so many ways, this government's plan does not make sense, shutting down an excellent facility, mixing low-risk youth with higher-risk youth, plopping an open custody facility in the middle of Saskatoon with no consultation. None of this makes sense. We requested a copy of the report prepared by Chin Planning. Insiders have told us that this report was positive about Yarrow, but this government refuses to release the report, claiming it's a cabinet secret. The question was, will you release the report, yes or no? I'd be a little bit more clear here, Mr. Speaker. We're talking about a report prepared by Chin Planning. Will the minister release the report?
Mr. Keir's daughter thought the extreme overcrowding, the hallway medicine, and the utter chaos of the emergency room, Mr. Speaker, she thought that that would be something that wasn't normal, Mr. Speaker. But staff in the emergency room told her that this was just a typical day. This government has had record windfall revenues every single year, but long waits in emergency rooms and hallway medicines, Mr. Speaker, is now typical. But let's look where they've been hemorrhaging money. They've had no end of money for the John Black Lean project. That's where they'll put their resources. That's where they'll put their time. They've got no end of resources for that, but they won't address the things that matter. Well, here's an idea how we can improve emergency waits and the prevalence of hallway medicine, Mr. Speaker. And they're mocking here, Mr. Speaker. How about we actually use City Hospital in Saskatoon properly? How about we have proper acute care in City Hospital? How about not shutting down the emergency room of City Hospital at 8:30 every evening, Mr. Speaker?
A lot of angry and frustrated people in Prince Albert about Devereux Developments being handed a contract for a health region housing project. It appears that this contract may have been tailor-made for Devereux. This is the same developer that bungled an affordable housing project here in the city. This is the same developer that this government admits it has a special relationship with.
In terms of what is a basic job of the government, you know, they can't connect the fact that in this community, the elementary school's in such a poor state of repairs that the kids have to wear jackets because they keep the windows open because the air quality is so poor.
Despite raking in record revenues, this government hasn't been able to get the job done when it comes to our schools. To the minister, what's wrong with shining a light on the true state of our kids' schools? What doesn't this government want parents to know?
Yesterday, the Rural Health Minister struggled to answer basic questions about the hyperbaric chamber in Moose Jaw. He refused to go out into the rotunda to answer questions from the media. When the Moose Jaw media tried to get answers from the member from Moose Jaw North, he also refused to talk. To the minister, what is it about the hyperbaric chamber in Moose Jaw that leaves this government so speechless?
And now, Mr. Speaker, the member from Moose Jaw North is tripping from his chair, and that's the only time you hear the member from Moose Jaw North tripping from his chair is when he's heckling in this assembly. But when time comes for him to speak on behalf of Moose Jaw, all you hear from is silence, Mr. Speaker. Silence, silence, silence.
Today, we have a chance to give small businesses in our province a boost by supporting a bill put forward by the Leader of the Opposition, the Buy Local Day Act.
The question before the Assembly is a motion by the Leader of the Opposition that Bill number 607, the Buy Local Act, be now read a second time. Is it pleasure of the Assembly to adopt the motion? Carried.